Hello, everybody. Thank you so much for joining us today. So welcome to EMMS International's update about our emergency response work with our Director of Programs, Sarah Gibson. Today, we will talk about some of the emergencies that we have been able to support our partners to respond to in recent years. Whether these emergencies result from climate crisis, natural disaster, disease, or the consequence of conflict. The greatest impact is always felt by the most vulnerable across the countries that EMMS works in. So I'd like to introduce Sarah. Sarah Gibson is EMMS International's new Director of Programs. Sarah holds a Master of Public Health from Johns Hopkins University and has worked in global health since 2003. Sarah has held a number of senior positions whilst living and working in several sub-Saharan Africa countries, including Tanzania, Malawi, Ethiopia and South Sudan from 2003 until 2020. In joining EMMS, Sarah brings her breadth of expertise to our programs across a range of health areas. So Sarah has been with EMMS for almost 6 months, Sarah, is that correct? And we are really delighted to have her with us today. So Sarah, my first question, starting in late 2019, the COVID pandemic was a global emergency that threatened healthcare systems in the UK and across the countries where we work. Can you tell us how EMMS responded to this health emergency, please?
Sure, Kirsty, it'd be my pleasure. So when COVID hit, EMMS had to do two things simultaneously and quickly. We had to adapt our ongoing programs and design new ones to specifically respond to the COVID pandemic. In Malawi, for our FCDO-funded palliative care project, we purchased certain items like mobile phones, airtime, laptops to enable some project staff to work from home, like we were all working from home. And we also bought other items like PPE, equipment to make hand washing stations at work, and even going as far as paying for transport to work to enable other staff to continue work in their place of work safely. And in the catchment areas of the 30 hospitals and health centres where we were developing palliative care services, we provided information to community leaders and staff about how to reduce the risk of spreading COVID and how to identify COVID cases and what to do if they found a case. Also in Malawi, we ran 2 emergency projects with a Christian hospital partner, Mulanje Mission Hospital, for them to make PPE to help protect staff and patients, and also working with young girls, teenage girls, to reduce pregnancies. With school out and young people with a lot of free time on their hands, there was a lot of teenage pregnancies occurring as a result of the schools being closed. In India, our main hospital partner, a Christian hospital called Duncan Hospital, was nearly overwhelmed by COVID among patients, staff and families. And I certainly can recall the footage of the COVID pandemic in India and how that was really overwhelming. So at that time, we were due to be building a new college of nursing at Duncan Hospital, but we postponed that for a year so that we could focus instead on raising funds to help the hospital cope with the COVID pandemic. So things like oxygen supplies for bedsides and food and non-food items for the community. This was important because a lot of the micro businesses had collapsed due to people not being out and about on the streets and lockdowns. So there was a lot of poverty, or poverty was heightened, and a lot of hunger. In Nepal, we delayed, again, we took the choice to delay the startup of our current FCDO funded project, which is about developing rural palliative care. We delayed it by 9 months and pivoted our support to supporting the new palliative care unit that we had already funded at Green Pastures Hospital to make sure that they could safely continue delivering palliative care services during COVID through home visits or PPE for staff and such like. Thank you.
What would be the difference in the way that people would expect to be treated here in the UK during a pandemic compared to the level of care that would be available in a country like India or Malawi?
Well, I think to be honest, before the COVID pandemic, I don't think people in the UK or Malawi or India had any particular expectation about how they would be treated in a pandemic, because thankfully, global pandemics are thankfully rare. I think the difference in expectation comes in around what we have traditionally expected from our healthcare system and what people in less well-resourced settings might expect. So traditionally in the UK, we have expected the NHS to have a deep bench to draw from in terms of human capacity, the right medical equipment, the correct drugs to meet our needs, whatever they are. Whereas in less well-resourced settings, people have tempered their expectations in line with their experience of a healthcare system that can or cannot meet those needs. So I actually think our experience of the pandemic and the tremendous pressure that the NHS faced and the limitations that were exposed in such extreme circumstances helps us have greater insight and possibly empathy for populations living in less well-resourced settings. It may be the first time we have collectively experienced what it feels like to live somewhere where a health system is truly challenged to meet the needs at the population level. I know this is a politically contentious point, and my point is not to get into the politics around this, but rather to highlight what it must feel like to live in a community where that safety net of a robust healthcare system cannot be assumed. Health system strengthening, both in terms of human capacity and health infrastructure, is a critical area to continually build out to meet the health needs of populations. And EMMS does a lot of work in health system strengthening through our work in global health workforce development in India and Malawi, and also with health infrastructure development, such as the College of Nursing at the Duncan Hospital in India.
So not long after COVID, EMS was asked to support our partners in Malawi when Tropical Cyclone Freddy wreaked havoc. Can you explain what damage was caused by this cyclone and how we, EMS International, responded to it?
Sure, sure. So Tropical Cyclone Freddy was like one of the biggest, longest lasting cyclones ever recorded worldwide, and the third deadliest storm on record in the Southern Hemisphere. So its impact in Malawi was multifaceted. There was a lot of displacement, particularly in the southern region. More than 650,000 people were recorded as displaced in districts in Nsanji, Mulanje, Palombi, Chikwawa, Zomba, and Blantyre. A lot of this displacement occurred in Nsanji and Mulanje districts, which were still recovering from the impacts of previous storms, Storm Anna and Cyclone Gombe in 2022. Roads and bridges and power supplies in these predominantly rural areas were extensively damaged, hindering the delivery of aid, food, and other types of assistance to these remote communities. And although crop and damages and losses were lower than expected, the impact of the cyclone contributed to the worsening food insecurity. Tragically, in Blantyre, a city I know well, although there were fewer displacements recorded, the topography of the city and the increasing urbanization meant that there was a lot of mud and landslides, which caused a really high death toll. After a few weeks of heavy rain, the rain falling on the sodden ground caused structural failures in the soil, and the fragile buildings on the hillsides of the urban areas, slid down the hills, causing housing destruction and impeding the return of people who had been displaced. Which, obviously that's a tragic loss of life when they were already fighting this storm and had thought we'll go to our homes to be safe. On a more positive note, EMS had unwittingly prepared one of our partners for Storm Freddy, in that we had installed solar power capacity in Mulanje Mission Hospital, and they were able to continue operating as normal through the storm because they had uninterrupted electricity. That is one of the things that all of our partners that we work with around solar power really appreciate, is that they can continue to operate regardless of what else is going on. And clearly in a situation like a cyclone, there's a lot of need for health services, and they were able to provide that to their communities. Finally, in response to Storm Freddy, we stepped up our program of improving water and sanitation in rural health facilities. We'd been doing that as part of a response to COVID, but with displaced people and a lot of groundwater, the risk of cholera and other waterborne diseases increased. So it was important to ensure that they had access, people had access to safe water and adequate sanitation.
And in Nepal, obviously Nepal is an area at risk of earthquakes, and EMMS has responded to recent earthquakes in Nepal. Can you please tell us what kind of response we give when earthquakes strike, and why in resource-poor countries like Nepal, natural disasters can have such a profound effect on its population?
Sure. EMS always works with in-country partners, and this is particularly important during an emergency when our efforts are in direct response to a country partner's requests. So our main partner in Nepal, the Christian organization INF Nepal, has a specialized emergency response unit. And when the an earthquake strikes or any natural disaster, they can deploy to the area affected to collaborate with other agencies to undertake a needs assessment and also ensure that their efforts are coordinated with other agencies and that there are no gaps in the response. Then returning to base, or they can communicate what the results of that needs assessment are and develop a proposal, which they can send to all of their overseas partners so that they can raise funds and procure the needed equipment, etc. In both the 2015 earthquake and the 2023 earthquake, our funds went to both food and non-food items. You can imagine in a country like Nepal, it can be sunny and warm during the day at certain times of the year, and other times it can be very cold. So making sure that people have access to warm blankets, hats, winterized tents while homes are rebuilt, all of these things are very important. And also the reconstruction of damaged health centers to enable people to get the treatment they need from injuries caused by the earthquake. The most recent earthquake in Nepal was very close to one of the hospitals where we are developing palliative care services. So two of the nurses that we have trained there were part of the whole hospital efforts to care for the injured and the bereaved.
You. Now, we spoke earlier about Cyclone Freddy, one of the many climate events caused by or exacerbated by the climate emergency. Only 1 year later, after Cyclone Freddy, Malawi has declared a state of emergency due to El Nino conditions across the country. EMS is responding to support the people of Malawi who are now facing hunger due to drought, obviously crop failure. Can you please tell us what we're aiming to achieve and what we've been able to do so far?
Sure. So maybe to give a little bit of background, on the 23rd of March this year, the President of Malawi declared a state of disaster in 23 of the 28 districts. So you can see how widespread that need is. And this is to help to feed over 2 million farming households that are affected by the El Nino spell. So many people in rural Malawi are subsistence farmers. They grow crops, and that is their food for the year. So if their crops fail, they have no means of feeding themselves for a year. So working with Palliative Care Association of Malawi, PACAM, who is our long-term partner in Malawi, we aim to provide maize flour, Malawi's basic food staple, to 2,596 palliative care patients and their families during this food crisis. This is particularly important for palliative care patients, both for themselves and their families to receive food, but also to ensure that the medicines they're taking for their conditions they can continue to take them and that they work effectively. So we're working in partnership with PACAM to ensure that we have a cost-effective approach to this by combining distribution of food with ongoing home visits that PACAM undertakes. we aim to provide each family with 4 50 kg bags of maize. That should be sufficient to feed a family of 6 for a year. Clearly, some families will be bigger, some families will be smaller, but we wanted to be able to offer a package that would support a family, a typical family, for up to a year. Um, for cost effectiveness, we're delivering the whole year's supply at once, and the families will have the opportunity to store and mill that as they need it. To do this, PACAM has been buying as much maize flour as they can just now, or maize just now as they can afford from commercial farmers in Malawi. Some farmers who have irrigation were able to mitigate the impact of the drought, so have been able to harvest. And PACAM is storing the grain centrally in Lilongwe and will use their vehicles to deliver the bags to the 21 health facilities that are providing palliative care. And then PACAM and the staff at those health facilities will deliver the food on through the home visits to the palliative care families. We're working in close coordination with local district health committees to ensure that those supplies are delivered and that the right authorities know of the work we're doing. If EMMS buys sufficient maize, i.e. that's 4 bags, 50 grams each for 2,596 palliative care families, that would cost £280,000. This includes the warehousing, the liaising, and the delivery. In the face of such widespread need, it's very difficult. It can become overwhelming to know where to intervene. So we are prioritizing the worst hit districts to most effectively target our limited resources. So we've started with those most impacted, and as we progress, we'll be able to reach out, hopefully, to all of the districts that are impacted. So far, we have distributed 1,148 bags of maize, which is sufficient to feed 287 palliative care, so about 10% of the total that we're aiming for. And those families are in Balaka, Chikwawa, Cholo, and Nsanji.
So, could you give us an idea? I think you've already answered this slightly, but what more we can do, and what's stopping us from kind of achieving that?
It's always money. I've worked in public health for a long time. It's not that we don't know what to do. We absolutely know what to do. And we have a very competent and trustworthy partner in country who has the relationships to do this. So as I said already, we're aiming for a very ambitious target of 280,000 to ensure all the families I've already mentioned can be provided with the food. If we're successful in that, what we would really like to do is also provide those same families with training and drought-resistant maize seed so that they can plant maize again next year. But if the conditions are also drought-prone, this maize would have a better chance of surviving. To do that would require an additional £260,000. So in total, that's just over £500,000 that we would like to be able to support the palliative care families we work with in Malawi. And if we were successful in doing that, we may as well dream big. We would also like to install good water and sanitation facilities in the 21 health facilities where those families already come to receive their services. So yeah, we have high hopes and big ambitions. To date, we've raised just short of £40,000, which is fantastic, and is really helping vulnerable people to eat and stay well through continuing to take their medicines.
Now, we know that conflict can create healthcare emergencies. Our supporters may well be wondering why, in the case in countries like Malawi or Nepal, where there is no conflict, why these healthcare emergencies are happening. Can you explain why conflict like the Russia-Ukraine war can have a catastrophic effect on a country already challenged by poverty?
Sure. So Put simply, the war in Ukraine has driven up prices of oil, food, and fertilizers globally. I think we all even have felt the impact on energy prices and food. The Overseas Development Institute simulations suggest that a 10% shock in oil, food, and fertilizer prices induced by the Ukraine war will reduce Africa's annual GDP by 7 billion. So we can see for countries such as Malawi that are already characterized by high levels of poverty, Russia's war in Ukraine has a double impact of driving up costs of basic commodities that they need to import, food, fertilizer, and oil, whilst also decreasing their GDP.
So you've obviously talked about this at great length. I would really like to know what it is about EMMS that means that we're able to act quickly and efficiently when emergency strikes.
A great thing, and one of the reasons I'm very proud to work for EMMS, is our partner organizations in country. We had our partners in all of the countries we work in have the quality and contextual knowledge to understand what's going on. EMMS always works with local organizations. This means that when an emergency occurs, our partners are already in place and knowledgeable about the extent of need and the best way to meet those needs, and able to do so as they have staff, vehicles, networks, and local knowledge all in place, ready to go. We listen to them. Our plans for fundraising and appeals are informed by what they tell us to ensure that we're addressing the real needs on the ground. And every pound that we raise for the emergency goes directly to address that.
Thank you so much, Sarah. That was really fascinating, and it's really great to know that together we can make a difference to the lives of others in an emergency. Whilst much of EM's work is creating sustainable healthcare solutions, I can certainly see why we're well placed to provide support in an emergency too. So thank you to everybody for joining us. We're very grateful for your time. I will share a recording of this call this afternoon so that you can watch back if you wish, or if you know of somebody who has been unable to attend today, then please do share that with them. And we hope to see you again soon at our next live event. Okay, thank you so much.